And I head up the project management team at InnoScot Health. I'm joined today by my colleague, Paula Sweeten. Just some housekeeping before we get started. This session will be recorded and be available to stream on the InnoScot YouTube channel. We'll have some questions, time for questions at the end. So if you have any questions for the panel, you can submit these on the chat box or in the Q&A section on Teams, and we can pick them up from there as we go through and put them to the panel at the end. So far in this series, we've looked at the innovation landscape in Scotland, where to seek support, practical intellectual property advice, and how to navigate the regulatory pathway. As we move into this autumn term, we're looking at more formalised programmes of support for innovation and entrepreneurship in Scotland. This session's a fantastic chance for you to learn more about how to develop your ideas and hear firsthand how these programmes can really catalyse the entrepreneurial journey to bridge that gap between concept and adoption at scale. Today, we're joined by guests from two programmes currently open for application. Suzanne Graham joins us from the Scottish Health and Industry Partnership to talk about their Innovation Fellowship Scheme. We've got Tamsin Holland Brown joining us from the Clinical Entrepreneur Programme to talk about the support offered there. And then we're joined by Debbie Wake of My Way Diabetes. Debbie is founder and CEO of this startup, and she's going to tell us more about how the support she's received has enabled the launch and scale up of her business. So we've got a fairly packed schedule today, but with some time for questions and comments at the end. So with that, I'm going to pass you over to Suzanne, if I can just stop sharing just now. You want to go ahead, Suzanne?
Yeah, thank you. I'm just bringing up my slides. Thanks very much, Gillian. Hopefully you can see my slides now. Great. Okay. Well, thanks very much for having me here today. It's a great opportunity to let you know about the Chief Scientist Office Innovation Fellowship Scheme that is currently open for application. So I'm Suzanne Graham. I'm a Programme Lead for Innovation Collaboration within the innovation team at the Chief Scientist Office. One of the areas I've been working on is the CSO Innovation Fellowship Scheme, which aims to strengthen the innovation culture to solve real problems within the NHS. And we know that we've got many of those at the moment, but it's all about improving the quality, efficiency and sustainability of our health and care delivery, and essentially supporting our recovery plan. So we had our first Innovation Fellowship Scheme launched last year. It was actually launched in May last year, and at the moment, at that point, we were really keen to get capacity within our innovation hubs quickly, so that we know that there's a lot of innovative work happening, but one of the main barriers to that happening is time for people to be able to contribute to these innovation projects. So we're really keen to get experienced and established staff to be able to equip them with the time that they really needed to take forward the innovation projects. So we aimed our first scheme at that more established senior cohort, and we were able to provide funding for 2 sessions of protected time, so a day a week of protected time for 2 years for people to be able to contribute and lead their innovation projects. And we had 9 places available across all of Scotland, 3 places per region. So we were really pleased with the applications we received for that, and we appointed 9 great fellows, and you can see their pictures there. We've got 3 across each of our regions, and they've now been working on their innovation projects for about a year, so they're about halfway through that first scheme, and they've got really exciting projects that you may have seen them present at different events, and some of their projects have also featured in national media as well, so you might see them popping up there. So it's great to be having such interesting work happening. So that first fellowship scheme, the main what it provided mainly was time for people to contribute to their projects, but they're also supported through their innovation journey from mentors from within the innovation hubs, and we also have quarterly learning sessions where we're bringing the fellows together to learn. The innovation landscape is new and developing, and we're looking to co-design and develop that support for the fellows as they work through that. So each session is developed based upon the needs of the current fellows. And I know you'll be hearing about the clinical entrepreneurship programme later, but we are looking to develop that community, innovation community, so that we've had opportunities to be able to bring our fellows and the clinical entrepreneurs together. So that was our first scheme, aimed at our the more established staff within NHS Scotland, but we were keen to offer other opportunities to people more that are earlier in their career. So we launched our academic fellowship, and that is targeted at clinicians earlier in their career, and we're really looking to develop the innovation futures of innovation leaders for the future. So this opportunity is quite a different opportunity. It provides the fellows with an opportunity to undertake a higher degree, whether that's an MD or PhD, depending on their profession. It's fully funded, including university fees. So the fellows would be undertaking their research on a almost full-time basis for 2 to 3 years. So we launched that first scheme last year, and we interviewed for the first scheme in January, and we're really pleased that we have appointed 2 fellows who you'll see on the screen there, Kate and Claire. I've just started their academic fellowships within the last month or so. So we're really keen to have more of developing that pathway of the future leaders, and we've currently got a new round for the academic fellowship that's currently open. So that opened in August of this year, and it's still open, so there is still time to apply, although it does close on the 12th of October. So the full details of how to apply is on our website. The application form and guidance is there, and all the information is there. We're encouraging applicants to make contact with the innovation hubs to discuss their projects. It might be that the applicants have their own projects, the project ideas that they want to develop in collaboration with the innovation hubs, or we do also have some example projects provided with supervisors within the guidance form. There's information there as well. So if anyone is interested in getting an application in, the first thing to do is get in touch with your innovation hub, and they'll be able to support you through that. So that's all I really wanted to say today. I'd be really happy to chat further and answer any questions, but otherwise I will stop presenting and I'll let you hear about the other opportunities.
Okay, thanks very much, Suzanne. I think we're going to hand over to Tamsin now, who's going to tell us more about the Clinical Entrepreneur Programme.
Hello, I'm delighted to be here. Thank you so much. Are you okay? Can you see my screen okay?
Yes.
Oh, wonderful. Thank you so much. My name is Tamsin. I'm the co-clinical lead for the NHS Clinical Entrepreneur Programme. And in fact, my own journey is that I started on the programme as a jobbing paediatrician myself, and applied a few years ago now. And because there are multiple opportunities through the programme, I actually have joined the team in the last 2 years. But it's no secret that of course it's hard being an entrepreneur. My own innovation, which I have been invited to let you know about, which I feel very privileged, is called Hear Glue Ear, which is a type of, it's the most common type of hearing loss in children, which makes it difficult for them to access education, and I'll tell you about that in a second. But I joined the Clinical Entrepreneur Programme at a time when it was only just really forming in the last sort of in its first 3 to 4 years, and we're now on cohort 7, and amazingly that means that we're starting to see entrepreneurs become serial entrepreneurs already. It's a workforce development programme open for all healthcare professionals. So it started only for doctors, but benefits enormously from the diversity of opening up to all healthcare professionals that are working within the NHS across Scotland, Ireland and Wales. And of course, it's hard working in the NHS. There is rising pressures, there's industrial action. We're just about to go into winter. We know how stretched our colleagues are. We're coping with waiting lists from COVID and also now industrial action. And so it's no secret that there are a lot of challenges. But following from Suzanne's talk, the amount of support that's there with this program, the Clinical Entrepreneur Program, and what Suzanne was talking about in her mention there, is that we are far too lucky to be pessimistic. We have an opportunity to be able to connect and share and learn and collaborate across the different parts of Great Britain, and be able to start seeing the future of healthcare. And we have now 1,000 in altogether clinical entrepreneurs, although people join for 1 year. They end up staying as alumni, so no one ever seems to leave, which is wonderful because they all support each other and it grows the network. We have entrepreneurs who have changed how medicines are given out to patients. We've got genetic testing that allows you to know which medicines will work for you. There are the wonderful gentlemen running the drone delivery service so that the medicine can reach you even if you're remote. We've got cancer diagnosis being the innovations that make cancer diagnosis much earlier. We've got bedside testing with different tests which used to take days and now can take minutes. We've got we're able to detect people who are about to not attend their appointments. And we're starting to see racially agnostic care through one of the clinical entrepreneurs who can monitor your health through your headphones. And of course, we're all living longer. So we're seeing clinical entrepreneurs delivering better dementia care, better frailty care. And of those 1,000 entrepreneurs, this slide is already now out of date. They've reached £1 billion, actually, between all of them, £1 billion in funding. Not that it's just about the money, it's about the lives that you're reaching. And we've got 500 of them have started a startup company, which means more jobs, and it means more patients are reached. So how do you apply to the programme? The programme has opened. It opened on the 2nd of October. And if you go to the website, which is nhscep.com, then you're able to check whether you're eligible to apply. And then there's, in fact, we've tried to make sure that there's lots of ways to see how to fill out the application form, and given you versions of ones that actually were successful and less successful. So we've put different application forms on there for you to be able to see how to write them. And we're also holding different webinars and prep sessions which to enable people to get ready and help them apply, and they can ask questions directly to the team. The team is incredibly supportive. Everybody's passionate about supporting everybody. So if you have any queries, it's fine to on the website. You'll see that there's a contact form, and we'd be really happy to support you to be able to apply. We have many industry partners now who provide a lot of mentorship, and they also provide industry partner days. We've had many people supported with that type of partnership, where, for example, recently we've had IBM being able to partner and help people with digital health and think about their data and AI. We've had several AI type of opportunities come up for people to really embed that within their innovations. The Clinical Entrepreneur Programme will also think about how you access funding, how you will scale your innovation, how you will run the research and get the evidence out there, how you will use social media, or the best way to use social media, and how to cope with people wanting to interview you, how you will build teams around you to make sure that you are not vulnerable and that you move forward in the most successful way. And we also have work streams that help people think about the environmental impact of their innovation and the social value around it. So we're incredibly lucky with the high value mentorship and partnerships that we have on the programme, and actually the wonderful network of previous entrepreneurs. So you're welcome to use the QR code that should take you to the website and the application. And we would really love to have more people from right across the country, because we know that that diversity and that collaboration makes every single innovation better. We also have a taster day. So in fact, how we run the Clinical Entrepreneur Programme, once you've applied, it's then free to attend everything. It's very deliberately done in a flexible way so that people who have families or are balancing a lot of work and their innovation can access the programme. And so every month there is both a networking day and also an education day. And we would love for anyone in Scotland to join us at our Glasgow, they're called Pit Stops, the monthly events, and to join us for the networking day, which is on Wednesday, the 11th of October in Glasgow. And again, you can register for that on the NHS Clinical Entrepreneur website. I have kindly been invited to just explain my own innovation and how I got to be here. I was a paediatrician looking after children with hearing loss, and I wasn't allowed to use some very expensive hearing aids for a cohort of children. The very expensive hearing aids were £3,000. So I developed that hearing aid there with a little microphone for £50 and an app which I've kept free through charity collaborations. It supports children in the classroom, and it also supports children to access online so that they get good speech and language enrichment and they don't fall behind at school. I did 4 different studies, and the spoiler alert is that it works. And what it started to do was, this is a letter explaining that a child did not need any surgical intervention because they were happy with using the headset. And it meant that the clinical pathway for children who have a very common type of hearing loss called glue ear, it normally is 5 clinical encounters, but that we can support hearing much earlier. It's a bit like a child going to school and realizing they can't see very well and not giving them glasses until they've seen 5 different healthcare professionals over approximately 12 months. And so what we want to do is support hearing, the children that have bad hearing, earlier, so that they don't fall behind at school and they're able to develop their confidence and their speech and language skills. And actually, we had a lot of interest in various different countries. This year we went to Malawi. We had a child who had used her headset, and even she actually managed to repair it, and she was able to pass exams at the end of each year. And now she would like to be a doctor to be able to help other people in her country. We also went to a deaf school where we were told that no one would benefit from this because they were all very, very stone deaf. But actually, I don't know if you can see the kid at the back smiling. He was asked if he could stand up, and he responded to that, and was asked if he could put his hands in the air. And so we've got this wonderful international partnerships with several countries actually, and we didn't want to be like the hearing aid companies who donate hearing aids but no one can buy the batteries to keep them going, so they sit in boxes instead. And so one of the things we did while we were out there was make sure that these headsets are chargeable with a little tiny solar powered device. I put this up not because to show all the great things that happen, but actually that for every page like this, that there is it's a very lonely, very hard journey where you desperately need the support of others, personally, to develop skills and to develop your innovation. And so that's why it's so important to have these wonderful of programs that support innovators. Thank you very much for allowing me to speak about the programme, and we would very much welcome people applying, and we would very much welcome anyone who is local to us in Glasgow or can get there to join us for the event where we network, and we can chat to them and speak to them about the programme if they would like. And any more questions about the programme, happy to answer them, or the team is happy to answer them via the website.
Thank you so much, Tamsin. That was really so useful to hear about the programme, but certainly your journey, I think, is just such a super case study of how having that support can really help move things forward. So for now, we're going to hand over to Debbie, Dr. Debbie Wake, and she is going to tell us about her experience of the Clinical Entrepreneur Programme and obviously wider support that she's received and how that has helped move her innovation forward. And we can see your slides. That's great. We're good to go.
Fantastic.
Thank you.
Great. Thank you, Gillian, and thanks, Tamsin. Yeah, thanks for the opportunity to talk today. So I'll just briefly take you through a little bit of my journey, and as I mentioned, talk about CEP, but also a lot of other support that is available, particularly in Scotland. I think we're very, very lucky. We've actually got a very rich ecosystem of support for entrepreneurship generally, and specifically in the health domain. So I thought for this audience, it might be useful just to do a bit of awareness raising around that, because we've hugely benefited from a lot of both accelerator and funding support from different organisations. But anyway, just to give a bit of background, who am I? As you heard, I'm a physician, I'm a diabetologist. I'm based in NHS Lothian now, where I do limited amount of clinical work, but still do occasional diabetes clinic at the Western General and at Leith Hospital here. I'm an academic, so I actually have a full-time contract with the University of Edinburgh now as a clinical reader in the Centre for Medical Informatics as part of the Usher Institute. But previously was an academic up in Dundee University, where I did my first consultant job and senior lecturer job, and that's where we spun the company out of Dundee University. So in 2017, I co-founded MWDH Health with Scott Cunningham, who comes from a technical background. We'd worked for a long time together on developing improving diabetes services in Scotland, which I'll talk a bit about, but that took me into this sort of journey of entrepreneurship, and it was obviously a big shift coming from my sort of traditional clinical academic background into the world of entrepreneurship and running a business, and I'm still learning on that journey, but there's no doubt that we couldn't have done that without all the support that we've had along the way. So just in terms of, very briefly, I don't want to talk much about what our innovation is, but just to give you the kind of backdrop of what we're doing. So as I said, MWDH Health is a spin-out company from Dundee University, but for, as many of you may know, in Scotland, we've had a very good diabetes IT and data-driven service for over 20 years, probably for about 25 years, when Sky Diabetes was put in place as a national platform in Scotland that collects data for diabetes from every point in the system: primary care, secondary care, hospital data, ambulance data, national retinal and foot screening programmes, from pharmacy data and so on. And this comes together pretty much in a real-time way so that anyone in the country who's managing diabetes, whether you're in primary, community or secondary care, can use that system to manage people with diabetes. And off the back of that, we've had this patient app that's been up and running for about 15 years called My Diabetes My Way. And that app allows anyone in Scotland with diabetes to basically access their electronic health record data, link up their home monitoring data, link into tailored online education, which could be structured courses that they work through. We've now got 13 structured courses, or ad hoc educational content as needed. And we also run these sort of big open courses where anyone from around the country, free of charge, can just join in and take part in sort of 2-day courses where we have live Q&As and online content. So we do that for patients through our app, and when we spun the company out, the app is called My Way Diabetes, and we mainly deploy this down in NHS England. But we also have a clinician-facing platform called My Way Clinical, which in Scotland we obviously don't need that. We have Sky Diabetes, but when we're redeploying these services in England or anywhere internationally, often we do need that clinician disease management portal and population management system to be in place to also deliver clinician decision support and population analytics. So what we're trying to be is really an end-to-end holistic solution for chronic disease management management, starting with diabetes, but now we're actually expanding into other long-term conditions, diabetes prevention, hypertension, cardiovascular risk, weight management, and so on. But we want to be that kind of end-to-end system that is very fundamentally data-driven. So as mentioned, we spun the company out in 2017 on the backdrop of the platform Scotland having run for about 20 years. I still support the Scotland platform, but it's non-commercial. It's a University of Dundee grant that we receive from the Scottish Government every year. And within Scotland, we've got over 70,000 patient data registrants for the data app, a backdrop of around 500,000 website users who've accessed education over that time. And in England, we're now deploying some national services for type 1 diabetes education and a number of regional platforms where we've integrated the data, and we're trying to run similar data-driven services to what we've got in Scotland. And those come under different names of both our own branding, and in some places like North West London, we've adopted local branding that was used traditionally for that service. We're also doing a bit of work internationally. We have an office in Dubai, and we're running a few projects in Saudi Arabia and trying to kick off a big project in Malaysia at the moment as well. But so it's been a bit of a journey over the last 7 years. We've now got about 48 people in the company, and yeah, a lot going on, and it's very busy. But as Tamsin says, it's hard. Every day is a hard journey trying to get this stuff and get innovation out into the NHS and abroad. I wanted just to mention my experience with the clinical entrepreneurship programme. So I think when I first met Tony Young, who established this programme, it's probably about 10 years ago. And at that point, unfortunately, it was just an NHS England programme. And as somebody living coming from Scotland, I wasn't able to join. But I always kind of stayed connected with the programme. And it's fantastic that now it's available to anyone across the UK. And I would strongly encourage people to sign up. I think because we didn't have access to this programme early, I went out and sought other routes to develop my own skills in terms of business development, innovation, fundraising, and so on. And then as we've been allowed to link in with the clinical entrepreneurship programme, really what it does is it brings all those things together. So anyone starting from scratch, it really covers absolutely everything from business planning to entrepreneurship more generally, raising funds, networking. It provides that peer support. And I think that's the most valuable thing, is just being with like-minded people, finding your tribe, because otherwise it can be a really lonely journey if you're trying to break out of a more sort of traditional NHS role into doing something that's more innovative, whether that's just within your own organisation or, as we've done, spinning out a company. So it does provide massive support. The mentorship has been absolutely fantastic, and the training is really comprehensive. It's absolutely everything you would need really to scale and grow innovation. And then they work through a sort of programme of different activities over the course of the year. So really, I can't rate it sort of highly enough. There's really no reasons not to join up to it. And if you can't make it along to every training session, there's always online materials, resources, and the programme is repeated. And as I say, I'm now kind of an alumni, but I still tag along to a lot of the training sessions and things to learn more and to meet people. But I just all wanted to flag as well in the background just other things that have benefited us that might be useful for people who are particularly in Scotland. So this is kind of our journey and some of the accelerators and awards and programmes that we've accessed over that time. So, within Scotland, we have the Digital Health and Care Institute, who we received some initial funding from. Converse Challenge is a great scheme if you are a university spin out. So if you have links to university and you're planning to spin out a company, basically this is a competitive programme that you can apply to. And if you end up in the top 10, you will get a training opportunity that basically takes you through how to develop, scale and spin out a company. But it has a huge support network as well. So that's worthwhile if you're at university spin out. Also, we've benefited from Scottish Enterprise and a lot of the work that we do, and we're account managed by them and get a lot of funding and support. And the Scotland Can Do programme is one of the sort of Scottish Enterprise programmes. We were lucky enough to join two other accelerators, which is the Digital Health London Accelerator and the NHS Innovation Accelerator, which again is an NHS England programme. So again, if you're looking to deploy services into NHS England, which is obviously a much bigger market than Scotland, this is fantastic. It is very competitive, and they take about 10 cohorts, 10 companies in through each year, but it really it puts in a huge support programme for scaling within NHS England and gives you a bit of a badge of honour really to go to the regions, go to HSN and go to NHS England centrally to be able to sell your service to them. You have to have a high bar to get into that. You have to have a good evidence-based innovation to get onto the programme, but it's really worth knowing about. And if you can get onto that as well, it is a great complement to CEP, to the Clinical Entrepreneurship Programme. And more recently, I just wanted to flag Tech Scaler in case people weren't aware of it, because again, this is a CSO government funded initiative. Codebase, who some of you may know as a kind of tech incubator, are actually running Tech Scaler. But again, it's only recently launched, but it's if you're a tech-based innovation company, whether you're health or otherwise. But there is a big focus around health, and again, they're putting together a whole programme of activities that are specifically focused around Scotland, but also can give you access to things like working space to go and actually meet other people, innovate. There's lots of events and networks and things that happen as a result of that as well. So again, happy, I won't go through all these different things that we've accessed, but happy to again pick up with anyone on any of these sort of opportunities that we've worked through in terms of awards, accelerators and so on, that's been helpful. Another one was actually the AI Accelerator, which is run through the sort of data-driven innovation and is linked in with the University of Edinburgh. Again, we did that a couple of years ago, and that was again fantastic, particularly for AI-driven innovation. So you have to be able to have some sort of AI component to what you're doing to benefit from that. But again, that was really, really helpful. So yeah, just highlighting here some of the things that are probably more specific to Scotland, which is the sort of Scottish enterprise. Scottish Edge was a fantastic source of funding. This isn't again health specifically related, but if Scottish Edge, you can apply. They run 1 or 2 funding rounds every year, and usually there's about £1 million in every round of funding that is deployed as free of charge, with no sort of dilution or anything, grants into companies who are scaling. Again, it's not health specific, but again, we got our first probably pot of, I think it was about 50k from Scottish Edge, which allowed us to employ our first employee and really got us on that kind of that journey of growth. And then we've kind of built on that with a lot of these other innovations. So if you've not heard of Scottish Edge, look it up. And again, you can apply through that. It's a couple of times a year. There's an opportunity there, and you can get some funding through that. And again, innovation funding, we've really jumped on every form of innovation funding that we can to try to get our innovation scaled. And Innovate UK has very much been our friend, or UKRI. So we've won a lot of SBRI awards, which are Small Business Research Initiative awards. We've also won a Digital Health Catalyst Award, and more recently a Precision Medicine Award. Plus we've had an award from NIHR for scaling and testing our AI components specifically. So there's a lot of money at the moment going into sort of AI. So if you've got an AI initiative, look up the NIHR AI Awards, and that's linked in with Accelerated Access Collaborative. Again, I'm not going to go through all these in detail, but I'm very happy to sort of speak to people about the sorts of funding that we've accessed over time that's really made a huge difference to sort of scaling our business. So that's all I was going to talk about today. Just really wanted to give you a flavour of what we've done, but very happy to answer any further questions.
Thanks so much for that, Debbie. That was really interesting, particularly, I think, for a lot of colleagues on the call, the funding that you've managed to bring in. I know that certainly a lot of people struggle with that element of it and securing funding. So I think we're going to, Paula has been monitoring and compiling the questions for the panel. So hand over to Paula just next.
Okay, thanks, Gillian. So we've had one specific query come in that's for Debbie. Someone has said, I'm interested to know what the process is for patients who wish to sign up to My Way Diabetes. Are they referred by a clinician, or is it open access? Also, are there localised variations, i.e. same or different in each of the 4 UK countries?
Yeah, no, good question. Yeah, so we have always intentionally not kept registration open to patients to register, because I think what we found is if we rely on clinicians referring people in, it's a very slow process and people forget to do it. So we have multiple routes in, but people can essentially just self-register. If you have diabetes, you go to the website and you self-register. Now we have to do a number of checks in the background that person is who they say they are, that we verify them, because we're at the end of the day, we're linking them to clinical data so they can see their NHS data online. So we have a sort of verification process that we run in the background. But essentially anyone can go to the website and register. If clinicians are seeing people in clinic and they want to just sign people up there and then, they can do that as well. So it's a quick and easy way of doing it, but we don't rely on that as the route. In NHS England, one thing that's been really helpful is we've integrated with NHS Login, which is essentially the COVID app in England is all run through NHS Login, and that means people are already verified. And basically, if they've got the NHS COVID app, they can use our service. So 75% of people have got that. They've got a login. We've integrated with that, so it means they can pretty much jump straight onto our service if it's commissioned in their area. So these have been huge enablers to getting large volumes of patients signed up quickly. And another thing that we've done to help with onboarding, both in Scotland and NHS England, is work directly with GP practices. And we've had to put the information governance in place that allows us to do digital marketing, which means we can pull down your entire diabetes patients' lists. And then on behalf of the practice, we will communicate with them to tell them about the service and get them registered. And we can get really high volumes of patients signed up by doing that. Because again, if you just wait for people to kind of find out about it through word of mouth, go to a website and register. If you proactively market them on behalf of the practice, which is a trusted source for them, that's, you know, how you start to get scaling and start to get the volume. These are all things we've learned over the years, but that's made a huge difference.
Okay, that's great. Thank you very much. We've had a few other questions come in, more general ones. So the first one I've got here is, what would you say to someone who has an idea for an innovation in a particular area and thinks it could make a big difference, but doesn't feel like they're a confident entrepreneur who could balance the demands of their day job and their family?
I'm sure.
Do you want to take that, Tamsin?
Yeah, I'm sure both of us could talk to that. I was thinking, yes, I properly understand that. I still work as a paediatrician, and I have 5 kids, and I accidentally started innovating, and I was actually really conscious because Debbie's story is so extraordinary. I was just looking at her and thinking what a total inspiration she is, and of course there she is offering support, and you've got all these amazing other programs that are open to you to offer support. And I thought that sometimes, you know, both Debbie and I have got scars on our back and have been doing this for many years now, and we definitely started as the clinicians that just had an idea, that had no idea about the next step to take or what to do. And I think that while the mature stories that we ran through are hopefully great to see that it's possible to get there. However, I definitely started very unconfident and very worried about the amount of time I had. I did sleep less probably at the beginning, and I think that, I mean, Debbie touched on this about how you need that support. It's a really lonely journey sometimes when you're trying to make a big difference, when everybody just wants to see the next patient. And so I did want to say that if you've got an early stage innovation, then you are very welcome to apply. And about 40% of people who get onto the programme have an early stage innovation, and about 60% are more mature. And it means that the early stage people are incredibly well supported to by the other 60% and by the network. I absolutely hear you that it is really difficult. I actually couldn't stand up and pitch my idea initially, I mean, which is amazing now because I feel much more confident doing that. So you will grow that, you will grow your confidence, you will grow your pitching ability, and it's very deliberately flexible for people who feel like they're juggling a lot. So we are supporting many parents, and we are understanding that people have got a lot on their plate. And I hope that if you join the programme that you would feel really supported in a way to move forward, because otherwise there's a risk of you giving up. Sorry, Debbie, you've probably got something to add.
No, I'd agree with that completely. And yeah, don't worry about joining the programme or thinking, oh, I'm too early for this or whatever, because a lot of this is about finding your tribe, because you know, there is a tribe of people out there who are exactly the same boat as you, or maybe just one step ahead, and they can really help you. And also just within your local community as well, try and find like-minded people, because there's a lot of people who will try and put you off. And you know, you need other people to keep you motivated. And if you can get, you know, so it's not just you going on this journey, but bring other people with you and do it as a team. I think it helped me having a co-founder, and also quite early bringing on somebody who was a chairman before we even really knew how to set up a company or do anything. We were introduced to somebody who gave his time completely freely as a mentor and ended up being the chairman of our board. And again, people like that can really help you. So yeah, build your local networks and join the Clinical Entrepreneurship Programme, and, you know, try and access some of these other programmes that we've talked about as well, to get support.
That's really useful, thank you. And there's one here that's a bit more specific for Suzanne, which is, which do you think have been the most noteworthy projects that have come out of the fellowship scheme, and what have been the most tangible benefits so far?
That's a tough question. I don't want to single anyone out because all the projects are really interesting and have their merits. The current 9 that we've got in our senior cohort have been very successful, that they've been able to get attract funding and from different sources. And I mean, I don't want to pitch it as that they're not in any way competing with each other, and as we've just been hearing, people will be at different stages of their project, so it's very difficult to compare. But I think it's for us just establishing our continued innovation infrastructure within NHS Scotland, and just thinking about the previous question as well about where you can get support for that, is that we've got our 3 regional innovation hubs, and that is where our fellows are embedded, working alongside the innovation staff and the clinicians working within the innovation hubs, and they would be working alongside, we hope that the clinical entrepreneurs will be linked in with that network as well. So I think that the impact is about just increasing that capacity and capability within Scotland to keep delivering and continually developing the innovative projects that are happening, and recognising that everybody will be at different stages. So their outputs, and we can't compare, you know, from one person to another. That the idea is that we will be building up this bank of innovation leaders for the future as well, and that recognising that it is very much a journey, and you can come into that via very many different routes, and really hoping that we can bring the community together, and because what people can learn from each other is amazing, and whether you would consider yourself a beginner or not, that everybody is learning from each other. And my experience within the community is that everybody's really willing to give their time and expertise, and obviously we've got other support networks as well. I mean, InnoScot Health obviously is a great support for our fellows and entrepreneurs for their journey. So I think, yeah, it's building that network, and if you don't, somebody within that network will know who can help you with your particular issue or area. So I think I've just gone completely off topic of what the question was. But yeah, the Innovation Fellowship Scheme is very much its early development. So we do have an evaluation panel, an evaluation framework in place that we do want to be able to demonstrate impact, and so there will be more of that coming, and we'll be doing case study development and that, so that we can demonstrate impact and secure funding for future rounds. So sorry, it was a bit of a roundabout answer there.
That's all right, thank you, Suzanne. So we have another question here, which is relating to the 1-minute clinical entrepreneur elevator pitch videos. So the question is, do you have any tips on how to make them as engaging as possible? And in your experience, what makes a pitch stand out from the rest of the crowd?
Yeah, you're right. So the application requires you to fill out the form. You need 2 references from people that you've worked with before, and you need to do this 1-minute elevator pitch. People have been very creative about it in the past. Some people have actually done it in an elevator, but you don't need to be fancy at all. You can't really give all the detail in 1 minute, so you just need to sort of outline it, give the story, and let people see your passion and your drive to want to about the bit that you want to improve. And so we've got lots on the website about how to deliver the 1 minute pitch, and we also do some pitching sessions, and in fact we've done one preparation session where we gave people a bit of some tips, and then they had a go at doing it just online just before they applied, without any pressure and in a friendly environment. And in fact, we have been asked to do another one. So we will make sure that we cover that again in some of the other ones that you'll see on the website. We've just got some evening prep sessions that you can join, or you'll be able to rewatch it. But I think that it's about being yourself, explaining your bit. Tony, as Debbie was saying, Tony Young is the National Clinical Lead for Innovation for NHS England. He tries to look at every single one of those 1 minute pitches. All applications will go through 3 different people. So they'll go through an industry expert and a clinical expert and a patient or lay expert. And then, but actually the 1 minute pitches he will try to look at individually. And so it's a great thing to do, to be able to put it in. And it's not just about your innovation, but also about the skills that you have and where we think that you can be helped on the programme. So you don't have to do anything fancy. It really doesn't matter. And there's a real range, and we don't expect you to be polished and brilliant at this stage. So just being yourself. If you can tell us what the problem is and how you're going to solve it, and tell us what the future looks like if you do solve it, then that's a pretty good start.
That's great, thank you. Sorry, we'll just pass back over to Gillian, I think, who's just going to wrap things up for this session.
Yeah, I thought I would just share the application links again. I'm not sure, is that working? Yeah. So as Suzanne said, the SHIP Innovation Fellowship, that's open just now, but is closing on the 12th of October. The link is there. I think Simon has put it in the chat as well, for ease. Lots of information on the website, including the application form. Similarly, the Clinical Entrepreneur Programme, that opens on the 2nd of October. Closing date for that is the 29th. I would really encourage you to have a look at the Clinical Entrepreneur prep sessions, which are all pre-recorded. Lots of information there about different parts of the application, some tips on the pitching and on the application form itself. Also, as Tamsin mentioned, there is that event in Glasgow, which is over the 11th and 12th. The evening of the 11th is the networking session. Some of the Innovation Fellows will be there, the current cohort of clinical entrepreneurs, so a good opportunity to hear more first-hand experience about the support that's available, how people have made use of it. So do register for that on the Clinical Entrepreneur website if you can make it along. From our point of view, the next webinar is at the end of October. And that's more about the InnoScot process and how we assess and evaluate the idea. And then the last session is at the end of November, and that's looking at innovation in other sectors. So the link to register for those is on the InnoScot website. So hope you can join us then. All that remains really is for me to say thank you so much to our speakers. Some really great stories there, and I hope you feel inspired to move forward with your innovation. And yeah, thank you so much.